cancer change your life? Dr. Jonathan Waxman of Boca Raton Regional Hospital joins us this afternoon to answer your questions about lung cancer. Thank you for your time. They are ringing words that nobody ever forgets. Let's talk about lung cancer and the basics. What is it? How common is it?
Thanks for having me. Lung cancer is cancer of the airways or of the lung tissue. At present time, it is the most common cause for cancer death in both men and women. Symptoms can be varied, and they usually represent involvement within the chest or outside of the chest. Patients can present with a cough, with or without blood that doesn't get any better, shortness of breath or chest discomfort. They can even be more non-specific, such as a headache, general malaise, weight loss, or back pain.
Smoking is, we see on cigarettes today, smoking kills, very obviously printed on the pack of cigarettes. But people who don't smoke, who have never smoked a day in their life, die of lung cancer. Is there a gene that predetermines whether you get lung cancer?
Well, there's some ongoing studies trying to identify this and hopefully use it as a screening test. As you mentioned, smoking is the most important risk factor known at present, and therefore there lies the importance of smoking cessation programs.
What types of lung cancer are there?
Well, lung cancer can be mostly, or 95% of all lung cancers are non-small cell and small cell lung cancers. Non-small cell being the most frequent, and they include adenocarcinoma and squamous cell carcinoma.
Can they be treated?
Yes, they can be treated. Surgery, chemotherapy, radiation alone or in combination can be used.
Is it successful?
Yes, it is successful depending on the stage of the lung cancer.
How is it diagnosed?
Well, it can be diagnosed by means of non-invasive or invasive methods. Non-invasive methods include imaging studies such as chest x-rays, CT scans, and PET scans, and invasive methods using procedures with the goal of obtaining tissue for diagnosis and evaluating the anatomy.
Are there some better treatments, studies going on for better treatments for lung cancer, Dr. Waxman?
Yes, there are numerous studies ongoing looking at treatments and various combinations to try to improve survival and quality of life.
Are you seeing improvement in success in treating lung cancer these days?
Yes, we definitely are seeing improvement.
If it's the most common cancer with men and women, should we have a diagnostic test? Should everyone have a lung scan at some point in their life?
Well, that is a very good question. Even though screening can pick up cancers earlier, still there hasn't been any significant change in survival.
That's what I was curious to know. Thank you for all the information. We appreciate it. Dr. Waxman is sponsored by Boca Raton Regional Hospital, and Boca Raton Regional Hospital also underwrites our Ask the Doctor segment. We're back with more in just a moment.